My name is Jasmine Mercado. I'm a speech therapist. I've been a speech therapist and I've been at Ephraim for about 3 years. I work in the hospital with inpatient services as well as the wellness center with outpatient services.
My name is Mindy Bullock Davidson, and I'm a speech language pathologist at Ephraim McDowell, and I have been here for about 10 years. So, along with my general certification for speech language pathology, I also am a board certified specialist with swallowing and swallowing disorders. And essentially, what that means is that I hold a greater level of expertise when it comes to things like dysphagia, also known as swallowing disorders.
My name is Bethany Berry. I have been with Ephraim for 10 plus years and I'm a speech language pathologist. I cover all different outpatient and inpatient facilities within Ephraim, including inpatient, McDowell Wellness Center, James B. Hagan, and Fort Logan Hospital. So I have board certification in swallowing and swallowing disorders, which is an extra certification showing advanced knowledge and skills in the area of swallowing, and just sort of to put that into perspective, about 1% of speech language pathologists have that certification. So it's a great honor to be able to offer that to the community.
So there's a wide-ranging scope of issues that can affect the adult or geriatric population in terms of speech language and swallowing disorders. Generally speaking, what we see in the inpatients on the inpatient side would be motor speech disorders, language disorders, and then a majority of our caseload probably is made up of swallowing disorders.
We cover a variety within our scope of practice. We work with voice disorders, cognition, speech disorders, including articulation, motor speech disorders, work with swallowing disorders, voice, and auditory rehab.
So speech language disorders, cognition disorders, swallowing disorders are secondary diagnoses to a primary issue. And so generally speaking, we see patients who have had an injury or an illness, and they have had a speech language or swallowing disorder come about because of that injury or illness. So often we will get consultations from physicians, but there are occasions in which we're the first person that they see because they are noticing a change in their speech, or they are noticing a change in things like memory or their ability to eat and drink. So we offer inpatient speech language pathology services, and so those would be at the main facility at Ephraim McDowell. We also offer services at Fort Logan and Hagan in Harrodsburg, and then we have outpatient services at the McDowell Wellness Center, and we also do home health. So we really reach the full spectrum of areas for a person to come in and see a speech language pathologist.
As far as inpatient in the hospital, we work mainly with swallowing disorders. So we do swallowing evaluations as well as completing modified barium swallow studies and fiber optic endoscopic evaluations of swallowing. As far as outpatient services, we are able to work with head and neck cancer patients, provide speech and language therapy, voice therapy, and LSVT for Parkinson's patients. We also work at the swing bed facilities at Fort Logan and Hagan, where we provide swallowing as well as cognitive therapy.
I love being an SLP just in general. I love being able to work with patients through what can be a really difficult time in their life and their families' lives. But I love that we are a community-based facility, so you see the same providers, you work with the same staff over and over again, or you may see that same patient come back in, so you're able to kind of work with them along the spectrum of their illness or whatever injury has caused them to come in.
My favorite thing about working at Ephraim is being able to build relationships with patients and work with them throughout their care, as well as being able to work with the staff and having a close-knit community with Ephraim McDowell, just community itself.
I actually have a lot of favorite things about being an SLP with Ephraim. I grew up in this community, and so right away knew that I wanted to work at Ephraim. So I started out as a student intern here, sought employment, and have been here over 10 years. I love the community integration. I love the continuity of care that we're able to offer. I love being primarily outpatient at the Wellness Center because I see the multidisciplinary approach that we take to patient care. So offering physical therapy, outpatient, occupational therapy, and speech therapy services. We work hand in hand with patients to develop best plan of care and best evidence-based practices with those patients.